I keep telling the joke, I said, this is by default and now it's become part of my life.
You know, na, that his daughter's husband,
Ah, Raj,
yeah, is so he's
Malvika's.
Malvika. So Malvika and we know each other very well. My
I know Malvika well.
I know her well. My wife also has worked with her,
Okay.
so we know her very well, Malvika.
Next time I meet her, I'll tell her.
Yeah, she's a and she's very connected.
Yes, yes. She Last week they had some pottery exhibition.
She's into all things. Chalo, we are starting.
Yeah.
Correct. Katie Dadanchi is here. She should be in. I've admitted her. Archana, shall we start? Good evening and welcome to Health Live at Seniors Today. The film that you saw just now doesn't really do justice to all the doctors we've invited because our doctor today, Dr. Asha Narde, this is her fourth time that she's been here on the Health Live platform, and we're really delighted to have her here. This session is being done on the occasion of October 1 being the International Day of Older Persons. And this is an initiative of the Dental Clinic of Breach Candy Hospital Trust and the Association of Geriatric Dentistry to celebrate, as I mentioned, the International Day of Older People, which is older persons, which is on October 1st. Thank you once again, Dr. Asha Narde, to be here. You are the person who reminds us about the fact that this day is coming up. Before I invite her to speak, and we requested her to speak about taking a multidimensional look at oral health challenges in senior adults. Dr. Narde is a conservative dentist and an endodontist practicing in Mumbai for over 3 decades. She is a consultant at the dental clinic at the Breach Candy Hospital, and she's also honorary joint secretary of the Association of Geriatric Dentistry. Welcome to Health Live at Seniors Today. How have you been?
Thank you. Good evening, everybody. Can I share the screen now?
Yeah, we can do that. Yes. So, as always, do remember that this is being recorded on September 27th. Okay, so, one of the new things that we've started, Doctor, is to announce the date, because sometimes people see it even after 2 or 3 years. You've been here thrice earlier. So if somebody sees something that you've done 2 years back, so do note that while the basic things about health will be the same, but there could well be some advancements. So this is being recorded and this is being conducted on September 27th, Saturday, September 27th. So do note that if you are coming 2 years later, or if you're watching it in 2027, you may want to get yourself updated about what. And of course, as you know, we keep inviting Dr. Asha here, so you will perhaps see a newer session by her. Do note that this is being recorded, so you don't have to take notes now. You can watch the show, and do remember that whatever is being discussed over here is advisory in nature, and you need to speak to you need to meet a dentist for clinical examination and for treatment. But of course, you can always get the advice over here. Over to you, doctor. As we speak, there are some 170 people here at this session. And I don't know how many people are there in the YouTube session, but I guess that number also will keep increasing. Over to you, doctor.
Thank you so much, Mr. Maheshwari, for having me over here on your show. And to all my audience, it gives me such immense pleasure to be in this chat room with all of y'all. I think this is my fifth year. I started speaking to y'all since COVID time 2021. And year after year, when I speak to Mr. Vikram Sethi, he's always so very energized about seniors today and us from the dental clinic to interact with you all, create awareness year after year. And we are so honored, so humbled by this gesture of yours to know and understand the nuances of dental health and its importance that plays in our overall health as we age. So, for the past few years, I have been talking to you all on different aspects of dentistry. We started with how to take care of our oral cavity and health during COVID times. From there, we moved on to 8 changes that happen in the oral cavity and how to take care of those situations. Last year, there were questions about what is root canal treatment all about? Was it something very scary? So I had a session demystifying root canal treatment. Plus, I wrote a keynote article in your magazine last September addressing the common dental issues in the aging population. So it also made me a little stumped this time as to what new could I bring to the table to share with you all to keep this interest in going in a renewed manner. So Mr. Maheshwari and I had a chat, and I blurted up some words like oral hypofunction. And the first thing he said was this will all go over everybody's head. And I said, yes, I will try and simplify it as much as possible. But this is something that is new. Maybe people are not aware. Maybe people are living with it and not sensitized about it. We talk about cavities, gum disease, oral cancer. But this is one aspect that I'm going to share with you all today. And if there is any doubt, please at the end of the session, I'm not going to keep it long. I would like to keep it interactive and feel the questions that you all can post towards me. And that would be a lovely evening then. So I termed this topic for the evening as a multi-dimensional look at the oral health challenges in the senior adults. This whole thing about having a program today was to honor the upcoming International Day of Older People on 1st October. Since we couldn't have a Zoom meet on 1st October, Mr. Maheshwari and his team and I decided that we'll kick it off today evening because I think this is the best way that I interact with y'all, share the thoughts, appreciate the older adults, the senior citizens of our country from all the different corners, that y'all are respected, loved, and y'all are thought of, and we look up to you. Though y'all have aspirations, we aspire to be like y'all. So UN, that is the United Nations, very aptly decided to term this year's theme as older persons driving local and global action, our aspirations, our well-being, and our rights. Just one moment. So the topic and the theme was older persons driving local and global aspiration, well-being, and our rights. So what does it all mean? First of all, to bring a small gist about older people. So in our country, the elders who are 60 and above, many of them have their retirement, and that is how they fall into the category of 60 and above as the senior citizens or the geriatrics. Whereas in other parts of the world where the aging is on the higher side, 65 and above is considered as the older adult or a senior citizen, and the is at 65. Though today, in many of our corporate places, the age limit for retirement has been increased to the age of 65 years. So when we look at our aging people, what is it that we want from them? We want them to be agents of progress, not mere passive members in the society. We want them to lead our immediate communities and the world, address social challenges, and drive out positive transformation. The biggest example is our Prime Minister. He's at the age of 75 and he's all out there aspiring that our country becomes a global icon. So, similarly, as you individuals are aging in your communities, in your homes, please be that aspiration for the people around. And at the same time, please ask and for your own well being. So, in this theme, what we say is our well being is your well being, ensuring that our country provides with enough of physical, mental, and for social environment that support your health as you age in a very respected and loved manner. The population of our country above 60 is around 10.2% of the entire population. So maybe we still are a young nation who hasn't provided enough of social security for our aging population. And that is the right and advocacy that is required so that towards the end of age, there is a kind of dignity and there is no discrimination in the way you live your lives. So that's why I take this evening to dedicate to this day to each of you because to us, I'm not too far away from being a senior citizen, but to understand that you are the driving local and global icon for our country. So when we come to healthy aging, let me just put again some numbers before you all. The population of our country is 1.4 billion. At the present time, the number of people at the age of who have a life expectancy in 2025 is around 73.5 years. And this life expectancy is going to increase to 77.2 by the time they are 2050. Those people who are above 60 as of today in 2025 is 1.2 billion, and it is believed that they will rise to 2.1 billion population. The number of people around about 80 years is growing even faster. What is believed that in 2050 there is an elderly boom that is going to happen. That means the youngsters below the age of 16 will be less and the number of older people will be much more. By 2050, 1 in 5 Indian is going to be above the age of 60 years. So when there is aging happening, there is a higher demand for healthcare, better social support. And with aging, there are age-related diseases, which as policymakers, as doctors, we need to look at it so as to provide a comfortable environment for the people. Today, what we see is with aging, common conditions like dementia on the rise. So there are ways and means of staving it, but at the same time, healthcare has to be even more objective towards providing comfort to our aging people. So this is again a very simple thing that I want to put forth to you that none of us can shy away from the fact that as we age, there are problems that set in. In our country of 1.4 billion population, more than 55% of the people above the 60 have one chronic disease. So when I say one chronic disease, it can be diabetes, it can be hypertension, it can be cardiovascular disease, it can be bronchial asthma, but at least one. That means more than half the population above 60 has one disease. And in that, 27% have more than two diseases. So you hear patients saying that I have diabetes and hypertension, I have diabetes and asthma, I have diabetes and arthritis, I have cardiovascular disease and rheumatoid arthritis, or cardiovascular disease and kidney dysfunction. So this goes on and on. And 24% of them have difficulties performing daily function, that is independently going to the toilet or independently having their meals or independently walking around. 40% have some disability or the other, while 20% of them have some mental health issues. So what are our aims in the elderly population? See, in our country, India, We till date believe in three generations living together. That means there are a set of grandparents, parents, and children. But this is slowly fading away. Children are moving to different parts of the country or to the world, leaving parents behind. Many of homes in different parts, especially what we see in South India and some of the Western regions, are parents are by themselves. And if you question any single person, I mean, if I question any of y'all on the group over here, what is your singular feeling that you have? That I want to age well. I don't want to be dependent on anybody till the last day of my life. And that is what is called as active aging, productive aging, and healthy aging. Active aging is doing everything possible to be physically fit and to go about with the daily activities. Engaging in social and community participation, like we having this Zoom talk, and I see this huge numbers that is over here. That means you are in the group of that you want to be a part of active aging, where you are connected to people of your age, you want to be heard, you want to do things that keep you happy and going, learn new skills that will improve your cognition. Productive aging. So that is again trying to do new things. Like I know so many uncles and aunties who take up things like not just singing and dancing. There are people who join, like in my gym, I see those above 60 trying to do not just about walking on the treadmill, they are about strength training, trying to lift weights, because somewhere along that brings in a kind of positive energy. And at the same time, when they are doing this, they want to do things for community, for the community around. So sometimes when there are youngsters coming in for training, they stand over there, they volunteer, see to that the kids are in line, see to that the kids don't move away. So those little activities that they contribute makes a huge positive difference to the people around. At the same time, when you age, please remember that you are aging with experience and wisdom. No AI technology can take that away from you. So, your wisdom, your experience, your skills are valuable for the young generation as well. So, try ways and means of sharing and contributing. And at the same time, when you do that, you remain happy and positive, and that's what helps in an active and productive aging. When you want to be active and productive, there is one thing that you need to focus on, is to be healthy. And how do you be healthy? By taking care of your health. It starts, and I, from the dental point of view, it starts from taking care of the oral cavity, because it's everything begins with the mouth. That's the first part of the digestive system. If you have a healthy diet, you need healthy teeth to chew on, and that's what brings in better nutrition, better health. There are age related changes that can be fought with, but taking care of your health in the early stages is part of healthy aging. You cannot run away from age related chronic diseases, but at every step, meeting your physician, addressing your issues, working around it, apart from taking medication, will improve the health. And that's what will make you lead an independent and improve quality of life. So, for every elder citizen, I would say age with dignity, age with a purpose, because you have valuable, you're a treasure trove of skills, wisdom, and experience, and be full of vitality, which can be palpable to the youngsters around you. So let me come to the topic that I would like to address today. It sounds a little different. As I said before, when we talk about a dentist or the oral health, what comes to the mind first is about cavities, gum issues, loss of teeth, dentures, and how to go about with it. But there is something more than that. There is a silent thing that happens in our body as we age. This mouth also tends to have a little decline or a reduction in the function, and that can impact the nutrition. That means if your mouth is not in great order, you cannot chew on your food properly, and that leads to a lack of proper nutrition. And this in fact affects your general health, and maybe the quality of life is affected. And that is what we term as a oral hypofunction. That means the functioning of the mouth somewhere is taking a beating which you don't realize. So, what happens actually? So, as I said before, aging, there are things that we cannot change. With age, there is a little loss of muscle strength and function. So, what is the muscle strength? The basic muscles that hold the jaws, the muscles that help you with the chewing, the muscles that coordinate the movement of the jaw, your lips, your tongue, somewhere along they slowly start losing their strength. And maybe because of that, you don't chew your food effectively, food remains in the mouth. Sometimes what happens because of aging is the salivary glands that are there at the side or below the chin, the salivation tends to reduce. And this is very common among patients who are on multiple medications, patients who take minimum four tablets and above. Because of the medication, the salivation reduces, the mouth becomes parched. There is a tendency for cracking of the lips, the tongue, the inner cheek tissue. So, those are the results of aging when the saliva is less. And then, because of the loss of muscle strength and the salivation reduce, there is a susceptibility to oral diseases. So why does it become susceptible to oral diseases? Because the minute there is salivation is less, there is a tendency for food to remain behind because the natural lubrication and the self-cleansing action is lost. When food remains behind on the surface of the teeth, they become prone to cavities, become prone to gum inflammation, and if unattended, it leads to loss of teeth. It can be because of health issues like diabetes, hypertension, or stroke, or rheumatoid arthritis. Now, what happens in diabetes is that if your sugar levels are not maintained, that is, if your HbA1c is above 6.57, there is a tendency that the bacteria that are present in the gum area will cause more and more of damage to the tissues around, and the gum is constantly infected. Over a period of time, the teeth tend to become loose, and sometimes when the dentist is trying to do and bring about health back by cleaning your teeth, it still doesn't heal. Just 2 days ago, one of my colleagues was telling me there was a major oral rehabilitation happening, and the patient, in spite of everything, was not showing the kind of healing that was expected. And she just and the patient said that she doesn't have diabetes, but out of sheer frustration she made a note and said, please get these blood tests done. And sure enough, her HbA1c was at 9. So there are diseases that affect the oral cavity and the gums. When you have issues like rheumatoid arthritis, what happens is that the ability to hold the brush in the hand and to clean your teeth gets compromised, as a result of which, again, it's the cycle of events of health issues, in the sense cavities, gum inflammations tend to get multiplied. And as I said before, medication given results in the reduction of the saliva, again causing the food to get accumulated, the self-cleansing action is lost, and the teeth become prone to cavities. And finally, sometimes it needs to be extracted because it's cavities all around, and the dentist is not in a position to save the tooth, and you have to go in for a kind of prosthesis. Either it can be dentures, or in the present day in the form of implants. So this is what I said about oral function. When the functioning of the mouth tends to impact the nutrition, impacts the overall health and the quality of life. And these three things, what I told you about aging, about diseases, that cannot be changed. Now, how do you identify that you have a kind of oral hypofunction, or that there is some loss of function in your oral cavity. So, scientifically, there are seven signs and symptoms that have been placed. And if the dentist spots three or more of those signs, it is termed as oral hypofunction. So, what is the first one? It is the lack of good oral hygiene. That means when your mouth is full of food all around the teeth, there are cavities, there are gum issues. The teeth are not maintained properly, the dentures are not maintained properly. Now, why does there are patients who say we brush twice daily and yet you say there is food collected around our teeth? Sometimes it is not done in an appropriate manner. Sometimes brushing alone is not enough. You need to use interdental aids to remove the food that has collected between the teeth, else it leads to cavities and gum issues. So, and sometimes it's because of medications that cause a kind of inflammation or the swelling in the gums, that the minute you put the brush against the teeth, the gums start bleeding. And so, what you do is shy away from brushing the teeth effectively. And again, it leads to food getting accumulated. Sometimes there is bad breath, the gums bleed, it is quite painful, and that is what we call as a lack of good oral hygiene. This can be compounded again with the presence of oral dryness. As I said before, because of less saliva production, it is a very, very painful condition. Patients who are undergoing radiation for cancer, because the salivary glands are affected, there is less salivation. They suffer from dryness, but simple medication at times given for hypertension and when taken for a longer period of time, or patients who have Parkinsonism, the medication prescribed for the same exhibit this kind of dryness. Their speech becomes affected, their swallowing is affected. So there are ways and means whereby we train our patients to tide over the condition. Sometimes it is simple sipping onto water every 1 hour, but patients who have kidney issues or cardiac issues, they cannot drink water more than 1 to 1.5 liter, because it is usually prescribed by the physician that the fluid intake is restricted. So, with keeping checks and balances, oral dryness can be taken care of. The third is your reduced biting strength. What I mean by that is that all physicians that you go to will say have a balanced diet. You need to have fiber, you need to have your vegetables, you need to have your fruits, you need to eat your sabzi, roti, rice. Or if you're a non-vegetarian, chicken or fish. But the minute you put the food into the mouth, if you do not have that kind of strength to chew onto food, you try to shy away from food. Or the minute you put the food in the mouth, there is pain and discomfort, probably because of a gum issue, or probably there is extensive decay, or you have a prosthesis in the form of a denture, which is old and which is giving way. So there is not enough of strength to hold the food in the mouth and chew down the food. So when there is a reduced biting strength, there it is something that you need to consult with your dentist and find ways and means of rectifying it. Sometimes it's because of extensive teeth. So, what we believe is that at least 20 teeth should be preserved even at the age of 80, because the very act of biting onto food, the very act of chewing onto food increases the blood supply to the brain. And we believe that the rhythmic chewing activity is also one of the factors that prevents cognitive decline, because the minute blood supply to the brain increases, the neurons are stimulated and cognition reduces. Coming to the next sign and symptom is reduced tongue and lip motor function. Now, tongue and lips are very important. The basic thing, when you say p, you bring your lips together. T, you make your tongue touch the palate. And t. So these kind of movements are very, very important, because if your movements of your lips and the tongue are not proper, the act of swallowing of the food or your speech is affected. Again, coming to reduce tongue pressure. Tongue pressure is again important. Try to put your tongue against the palate, against resistance. Can you feel the resistance? Well, that is required when you're chewing your food, when the food becomes a bolus and the food has to be swallowed. So, if there is less tongue pressure, there is less chewing activity of the food, and as a result of which, food tends to slip out of the mouth. So, tongue pressure is very important. Tongue pressure reduces if you have certain neurologic issues, which again should be discussed with your dentist or the physician, and it should be checked and rectified. Reduce chewing function. As I told earlier, if your teeth are not in great shape, if you don't have adequate number of teeth, or you have a ill-fitting prosthesis in your mouth, or your gum issues are persistent and not treated, you tend to avoid on tough food, or you have issues in the mouth. So there are patients who come to us and say, the minute I've put food in my mouth, especially masala food, my mouth hurts, as a result of which I don't want to eat regular food. I want to eat something like pasty food or maybe soup which I can just gulp down. So these are situations where the chewing function is affected. So you avoid the diversity of food. You just land up having some kind of maybe a protein based mash or a fiber based soup or something, which is not the right kind of a diverse meal in the plate what should be advocated. So the minute the nutrition slips, you go into a malnutrition, your general health tends to be affected. Also, when the chewing function is not proper, you take a longer time to eat your meals. Then there is something known as reduced swallowing function. So sometimes while eating, you tend to choke, you tend to cough, especially when you have water. It could be that there is some problem with of the nerve supply to the tongue or to the palate, could be age related, or it could be that it is post cancer where some surgeries have been done or some trauma. Again, when you have frequent coughing, choking, difficulty swallowing, these are things that need to be addressed to your dentist and solutions should be found. So, as I said before, when you have a lack of good oral hygiene, when there is a tendency for oral dryness, when there is reduced tendency strength in chewing onto your food, or your tongue and lips do not have the kind of motor function, or your tongue doesn't have enough of pressure, or there is less chewing function or swallowing function, and if any of these three signs are present or more signs are present, it is what is termed as oral hypofunction. I hope I have made some sense into what I have been trying to communicate, because this is a little different, little new. We can always talk about it in the chat or the interaction. And why does it matter? Because if you have oral hyperfunction, your nutrition is definitely at risk. And if your nutrition is at risk, then you go in for a restricted soft diet, which does not have all the nutrients that are required and can lead to malnutrition. And this can result in your overall health being affected. When the chewing is not there, as I told you all, the cognition can be affected. The quality of life, what you want to convey when you speak, sing, or swallowing, when it gets difficult, dribbling, these all reduces the quality of life. It makes a person less confident, and many a times they try to move away from social interaction. So the gist of it is, visit your dentist periodically. Seek professional guidance when you feel something is amiss, which is very, very important. We tell our patients once in 6 months. I tell my patients, the ones who have health issues and recurrent issues to come once in 3 to 4 months. Patients who had dry mouth, we put them on a protocol to visit every 3 months, because we have to keep looking at it, because sometimes in spite of the way we put a regime for them, the dryness continues. And if you don't take care, you are very, very prone to cavities or kind of breakdown of the cheek mucosa, which results in burning sensation. Food intake is not great. Again, that leads to ill health. Maintaining a good oral hygiene. I'm sure all of you all know that brushing your teeth twice daily is very important. Apart from that, sipping your onto water from time to time, but do not overdo this. Do not drink half a liter of water before going to bed at night. It has to be sips of water, at least 1.5 liter of water through the day. Do not overdo it. Apart from drinking water, use of mouthwashes, if you have gum issues or if you're prone to cavities, will definitely be beneficial. Use of interdental aids. So what happens is that with age, the gaps between the teeth at the gum levels increase. So there's always a tendency for food to get stuck between the teeth. So there are aids like a thread, what we call as a floss, or there are some uni-tufted brushes, proxa brushes or interdental brushes that remove the food that is accumulated between the teeth. So at night before going to bed, brush your teeth, use these aids, and that will help you. There is something known as a water flosser available these days, where you have jet water spray in a small bottle with the nozzle, something like a pitchkari, but it comes with flow. Now, many of the senior citizens do find it difficult because it's a handheld device. To hold it firmly in your hand and to keep it exactly between the gaps of the teeth, there's a huge flow of water. So sometimes it disappoints them. So even if you can't use a water flosser, brushing your teeth twice daily, using a little proxa brush definitely will help you. And as stated and overstated, is that regular visits to the dentist for early detection is very, very important. We all know the common complaint that I get from senior citizens is that dental treatment is so very expensive. But there is something known as prevention is better than cure. When you go for regular follow ups, get your cleanups done. If there is a small cavity, it can be sorted in the early stages rather than waiting for a stage where it goes for root canal treatment and crown, or maybe extraction, dentures, implants. That's what increases the cost. So routine checkups prevent even the cost of treatment from escalating. Stay hydrated to reduce the oral dryness. Sip on water judiciously but regularly. You eat nutrient rich food. A diversity of food is very, very important. So your oral health and general health are maintained. Simple exercises of the tongue, lip, chewing exercises maintain the strength, especially in patients who have issues of swallowing and have difficulties with their lip and tongue motor movement. So these little tips that I have given will definitely go a long way in having a healthy aging. So your aging can be productive and can be active in nature. So I hope I have made a little sense. I have spoken a little different from what I normally do, but I feel that these need to be addressed because you are a highly motivated group, you are a highly aware group. So things like what is oral hypofunction, what other signs, now that I have opened it up and spoken to you, you yourself can self examine and see whether you have issues about oral hygiene, whether you have issues of dryness in the mouth, whether you have issues chewing onto food, whether you have issues biting onto food, whether you have problems with your lip and tongue in the movements. Does your food dribble out? Do you have difficulty swallowing? If you have any of these issues, please get it addressed with the dentist. With it, I conclude my talk and now we can open it up for further discussion.
Thank you very much. Thank you very much for an amazing session. You Yours.
I hope I made
Presentation.
sense and I hope it didn't bounce.
Your presentation was, very detailed. So, but anyway, there are some questions which I'll just take. Uh, One is from Shamla Ravi, who asks, "Does dental uh, caries does it lead to oral cancer?"
Okay. Dental
Or
caries.
and there's another question from Mukta Garg who says, "Is root canal does it lead to oral cancer?"
Okay, so first I'll address about dental caries leading to oral cancer. So what happens is that when you have cavities in your teeth, unknowingly the teeth get weakened, which you may not realize, and it chips away. So the broken part of the tooth, which remains in the mouth, can have sharp edges, which can rub against the tongue or the cheek, and that's what leads to cancer. We have a lot of patients where they ignore because the fear of the dentist, because of the fear of the pain, or because of the costing, people shy away from it. And finally, it's like a wildfire. Like I had this lady who had come down from Lucknow. Her left side of the tongue had to be excised with some of the glands and all those things for the simple reason she had a cavity where the tooth broke down. It was hurting her tongue, but she had this fear and phobia, and poor thing, she's such a docile, unassuming person, had to undergo the surgery, radiation. So her son was very sweet. He put her onto proton therapy, which is available at Tata's, one of the most expensive forms of radiation. But still the agony that she had to go through, just and she kept telling me, doc, ओ एक विजिट अगर मैं डॉक्टर के पास गए थे ना आज ये मेरा हालत नहीं होता था. So do not ignore when you have a dental cavity. Now, coming about this huge propaganda that we see online about root canal causing cancer, all kinds of health issue. Well, this is not substantiated at all. This is a, I don't say it as a myth, I say it is misinformed. In the sense, what happens is that when we do root canal treatment, the whole idea of doing root canal treatment is to preserve the function and the form of the teeth. And it is cost effective because the minute you extract, you're going to wear either dentures, which many a times patients do like it, or you want to go in for implants, which is much more expensive. But in some situations, when there are huge ball of infections around the teeth, and if it hasn't healed or something, so maybe in some few cases, and it's not it those bacteria that are present can enter the bloodstream and can cause health issues. But it is not about root canal treatment per se causing other health issues. Please go ahead and get endodontic treatment or root canal treatment done. It is a safe treatment in our country. It is most cost effective and it is done at global level. When we visit other countries and we see that even the middle class over there cannot afford root canal treatment the way here across the classes people can avail it.
Right. Thank you. We have a question from Katie Dadanchi who asks, "Doctor, while using floss, why are we told not to use waxed dental floss?"
No, you can use it. There is no this thing. Whatever you're comfortable with, you can. Only thing be careful about is that, when there are restorations present in the mouth, when you're using a floss, do not push it in such a way that you try to uproot a crown or a
Right, right,
restoration.
right. Okay, we have a question from Mr. Akhori Mitunjay Kumar. He says, "I'm 73. Um, why after capping sensation increases?"
Why after capping? So many a times, there are two reasons for it. One is that sometimes crowns are done without root canal treatment,
Sorry,
as
sorry, sorry, sorry. Yeah, go ahead, go ahead.
yeah, as need may be. So sometimes if there is a fine gap between the tooth and the crown, they can be sensitive because the nerve is still alive. Sometimes the crowns are done as a part of a total rehabilitation because the teeth have worn out totally and we try and increase the bite. So when there is something new with where we raise the bite in the sense that the vertical dimension increases so that your joints is in certain position, that can cause sensitivity. Or in some cases, maybe because the crown is a little high compared to the other teeth, the stress of the bite can cause sensitivity. So you need to check with your dentist as to what is the cause, whether it was a live tooth on which the crown was placed, whether there is a kind of micro leakage, whether the crown is a little high as compared to the other teeth, or where all the teeth are raised and it's something new and that is why you feel sensitive.
Right, doctor. We have a question from Anupama Singh who asks, what should be the frequency of using mouthwash, the mouthwash that you get in the shops?
See, using the mouthwash varies from person to person. It's not that every single person has to use a mouthwash. If you have a good oral hygiene, if you're free of gum diseases, even if you brush your teeth and gargle well with water, it is more than enough. But if you have a situation where you have gum disease, where you have tendency for bleeds that occur, that's when an antimicrobial mouthwash, which contains chlorhexidine gluconate, is given. Those kind of mouthwashes are usually prescribed twice daily after breakfast in the morning and before going to bed. Then there are mouthwashes that are given for sensitivity to hot and cold. These have fluoride content in it to reduce the kind of sensitivity, again, to be used twice daily after breakfast and before bedtime. Again, once the symptoms subside, then you can even discontinue using it if your mouth is in a good condition.
For the benefit of others, do remember that this is going to be recorded, so you may not have heard the ingredient that doctor has said just now, because obviously she's not taking the brand name, but you can hear it on Monday evening when we have the session on our site. There's a question, two more questions. One is from Sunita Verma. What is the cause of sleep bruxism?
What is the cause of bruxism?
Yeah.
Teeth bruxism.
Right.
See, bruxism is a subconscious habit. There is no reason as such, but we put it down to stress many of these days. Bruxism is something that occurs when you, in your subconscious sleep, you tend to grind your teeth. But these days, we see even patients clenching onto their teeth, and there is where that occurs. Simple thing as watching TV or maybe sitting at the computer and doing some work, that you tend to unknowingly do it. So we prescribe something known as a bite guard that reduces that kind of pressure on the teeth, because it becomes an interface, so that stress is borne by the guard and the wear of the guard takes place and not of the teeth.
Right. Two more questions, doctor. One is from Paramjit Kaur, who asks, wisdom tooth in diabetic patients should be removed at the age of 73?
Wisdom teeth in diabetic patients, these are all case specific, in the sense, it's not that everybody who has a wisdom tooth at 75 should get it extracted, or every diabetic should get it. If you are a diabetic and your wisdom tooth is causing trouble behind, in the sense that you have recurrent gum issues around with it, or it is impinging on the other tooth and there's a tendency for decay to form and things like that, then it is advisable to get it extracted, provided your HbA1c is 6.5 and below.
Right. And one last question, how often must we change teeth caps?
So see, normally when we fix a cap, we tell the patient that it's around 8 years. Well, it is not like that. It's not that at the end of 8 years, you have to go and electively remove a crown and put a new crown in place. So once a crown is put in place, if you maintain it well in terms of brushing, flossing, if the cap is fixed well against the teeth, even after 8 years, if it remains proper, there is no need to remove. Sometimes what happens is that over a period of time, the gum tends to recede, and then there's a gap between the gum and the tooth. And if there is a tendency for food to get accumulated below the crown, then it is definitely required that the crown is changed. Or because of chewing stress, if there is a hole, what we call as a perforation in the crown, then the crown has to be changed.
Doctor, one last question. If a person is in the habit of grinding one's teeth, and there is something which is called where you can put a brace kind of a thing in the night, is that advisable?
Yes, the brace, what I call as a bite guard, is the brace.
Right.
So that is definitely advisable. There are different forms of braces. Sometimes we give a soft brace, we give a hard brace, depending on the intensity of the bruxing that has occurred.
Right. Great. Thank you very much. We've had a record number of people um, uh, for this session today. We've had 208 people, 207 right now, and over 1,000 people watching it on YouTube. It just shows that that there is a fair amount of interest um, for dental care and dental treatment. And thank you once again for being here on this special session on the day for World Day for Older Persons, which is on October 1st. Thank you, and to your association where you are doing a fair amount of great work for older persons. Please, all power to you, and best wishes.
Thank you. I seek blessings of all the senior citizens over here that this is the first association in the country that is focusing on the geriatric needs. So we have an arm that is focusing on creating awareness in the dental specialties. There is an arm for community awareness. So we have just begun this journey. So I seek your blessings that we propagate what is active, productive, and healthy aging to every citizen of this country.
And if there's any way with seniors today, we can, we are anyway doing it in various forms already. So if there is some association that seniors today can have, we'll be happy to do it. As always, do remember that we'll be back again next Saturday for another session of Health Life at Seniors Today. We complete 5 years of Seniors Have Talent. So that is a special 5-year special tomorrow at 12 noon. So please do that. Do remember that. And a host of other programs that we have through the week every day on Evergreen Club. The magazine that we publish every month has been published on 15th, so you can experience that on our website seniorstoday.in. Do remember there is a newsletter which comes every morning at 6 a.m. so you can read that Monday through Saturday. Of course, there's a host of other things that we keep doing. Thank you very much, Dr. Asha Narde, for being there and for being there every, so often. 5th session that you're doing for us. So delighted to have you again. And, let's have one once again very soon. Thank you.
Most welcome. It was an honor, a pleasure, and totally humbled by the numbers that were there.
Thank you very much. Thank you.
It
Bye-bye.
makes more meaning to what we do.
Absolutely. And, it just shows that a topic like this, dental care, of course, is very important. And but as I was telling you before the session, I was not very sure about the numbers being as large as it is, because heart care, etc., might have larger numbers. But it's very good, very heartening to see that this session has got so many people. Thank you very much once again. Thank you.
Thank you. And I hope it made sense, because this is not the routine cavities, gum problems, and root canals.
The thing with dental care is that it is upfront, right? If you have a problem, you get to know about it immediately. Something else inside the body, you may not know about it immediately, but with the teeth, you get to know instantly. So I guess people are also very concerned about